Hi guys, Kelly here coming to you from my kitchen in Boise, Idaho. Today I am talking with you about my personal philosophy regarding nursing and healthcare. And what I've found is that my philosophy is really based off of three key terms from the American Nurses Association definition of nursing. I know now we're all a couple semesters into our programs at Gonzaga, and I just would like to, and I'm sure we've all heard this definition, but I would like to revisit it and say it again, that nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. So this definition is probably something that we all want to be or to strive toward as nurses, but there are a few key terms within the definition that really have shaped my own philosophy of nursing and healthcare, and those terms being promotion, protection, and advocacy. Not only can they be applied to our patients, but also to their families and to ourselves. So we are our own best advocates, and when we're suffering emotionally, physically, or spiritually, or whatever, it becomes impossible to provide the best possible care for our patients and their families. With that being said, it is extremely important to take care of ourselves first so that we can be the best possible care providers for our patients. So going into these terms with a little more detail, let's start with promotion. Promotion means to me that we as providers have the responsibility to promote our patients' health and well-being to the best of our capabilities. We do so by having those health promoting conversations with our patients, which of course aren't all going to be the same since each patient's situation is different, but we need to be flexible to each patient's learning styles and literacy levels, and in the end, hopefully come out of these conversations hoping that we have started a process of enabling and empowering our patients to increase control over and improve their own personal health and well-being. And then next is the term protection. Protecting our patients is probably a given, but it is crucial in the art of healthcare. Not only are we protecting our patients by providing safe care, but also we are protecting their rights. Not only their basic human rights and the rights to optimal and safe healthcare, but also and especially their rights to privacy and confidentiality, to informed consent, and even the right to refuse care if they are a competent adult and are able to make those decisions for themselves or even their child. So we as providers have the responsibility to acknowledge those rights, honor them, and protect them to the best of our abilities, even though we might not always agree with them personally. So finally, I'd like to talk about advocacy. Advocacy is a very important word to me with regard to my personal nursing philosophy. It is also a very powerful word when applied to healthcare and can best be defined as patient equality, freedom from suffering, and the preserving of patient dignity. So patient equality, meaning that we must provide all of our patients with the same degree of professionalism and compassion without letting our own personal prejudices or biases influence our practice. So one way I like to look at that is to leave our ego at the door before we even enter a patient's room. It's always best to give our patients an objective and neutral examination in order to treat them appropriately. And the second part to patient advocacy as a provider is to provide some level of freedom from suffering, whether it's the suffering is physical, emotional, or psychological. It's many times the reason why patients are seeking out healthcare or why they're coming to see us to begin with is because they're suffering, they're in pain, they're depressed, or whatever. So it's our responsibility to advocate them and help provide some level of comfort. And lastly, as patient advocates, it is our responsibility to provide and preserve patient dignity. So therefore, treating our patients and their families with honor and respect, being sensitive to their cultural and ethnic and religious beliefs, as well as helping our patients to navigate an oftentimes pretty confusing and foreign healthcare system. So that is my personal philosophy regarding nursing and healthcare. And that in the end, I think that what we are all striving for is to help provide some sort of positive outcomes for all of our patients. So there you have it. Looking forward to working with all of you over the course of the semester.